am Dr. Rajgopal from Apollo Hospitals, Hyderabad. I am a urologist. Urology is a specialization of surgery covering in diseases of kidney and urinary tract and the genital tract in male and urinary tract in female. So the common disorders of urology include kidney stones and prostate related problems, people who cannot have children called infertility, people who have sexual dysfunction called erectile dysfunction. These are the main problems which we see apart from others. Coming to kidney stones, the kidney stone disease is a very common problem in young people between the ages of 20 and 50. Therefore, it is very important for us to address this problem because it involves young people who are in working age group. So, main causes of urinary stones is due to lack of drinking water. If you don't drink sufficient water, then due to the concentration of the urine, you tend to form stones. It is very easily preventable by checking up regularly. Maybe people who are very highly prone to form stones, they may have to have a regular checkup. They should make sure that they drink sufficiently large amount of water. They do simple tests like an X-ray, ultrasound and urine test, and they can take necessary action to prevent the stones becoming problems.
I deal with brain and spine. Of course, there are certain diseases in brain and spine which you can always blame God for giving you. But there are a fair number of diseases in brain and spine where the blame has to come on the patient itself. And these are the diseases of lifestyle. You will be surprised to know that the two most major contributors of brain and spine diseases are road traffic accident, hypertension, diabetes, stress leading to cerebrovascular such as stroke, and lifestyle diseases where obesity, sedentary lifestyle, lack of exercise leads to spinal disorders. If you take away these three conditions, road traffic accident, stroke, brain stroke, and spinal disorders secondary to bad lifestyle, you will be able to cure 60% of your population from these diseases. It is a major load for any country, especially a country like Tanzania, where the resources are limited. And if those resources are used 24/7 on trauma, on stroke which can be prevented in a fair number of patients, or spine operation for disc, etc., it will open space for a lot more other treatment for the diseases which don't get to be looked at. Every country has a priority, but you can't differentiate people. But definitely you can educate your patients, educate the society to live healthy, work healthy, and most important, exercise healthy. Obesity is a major problem in the society, especially in Africa, especially in this part of Africa. That is mainly dietary. With such lovely nature around, I am always surprised why people do not walk fast, why they don't take an evening walk, why don't do they exercise. I can see that they have tremendous love for food, they are relaxed people, but probably these things will make so much difference. They will be able to enjoy their food much better. Hypertension and diabetes is creeping in here in a big way, leading to brain stroke. Brain stroke is not a disease for the patient itself, it is a disease for the whole family. When the whole family with their limited resources have to look after these patients for years or decades to come, and it is not an easy job. The state does not have that kind of finances to support these patients in the state system.
We have been coming to Tanzania for the last 14-15 years, and what we have found that breast cancer happens to account for the largest number of deaths in Tanzanian women. Breast cancer is chiefly the cause. Apart from this, you have cervical cancer also, but today we would be concentrating on breast cancer. Breast cancer is a cancer which cannot be prevented, but if detected early can provide very high cure rates. The important thing here to remember is when a lady has a lump in her breast, a cancerous lump in her breast, there are already 1 million cancer cells there. So even a small lump of 1 centimeter size contains 1 million cancer cells. So it is very, very important before the lady feels the lump in her breast to detect the breast cancer. Now how do we do that? The first and the most important method of doing that is by mammogram. Mammogram can detect a breast cancer when it's the small size of 2 millimeters to 3 millimeters in size. And this is a very, very early stage of breast cancer. Ladies who are detected with this cancer at this stage can be cured of their cancer. So it's very, very important that mammogram is incorporated in the surveillance program for Tanzanian women. It will lead to detection of breast cancer at a very early stage, leading to cure, very high cure rates. It will lower your hospital burden because most of these patients will be cured with surgery. They may not require chemotherapy and radiotherapy, reducing the financial burden on the state.
Kidney diseases are gradually getting more and more in society today, and everybody seems to be concerned about it. The most common causes of kidney disease, at least in adults, are diabetes, high blood pressure or hypertension, smoking, obesity, the use of unnecessary medicines, particularly painkillers, and in case they are used without proper medical assessment and prescription, and many of the indigenous drugs which are harmful to the kidneys. You should avoid, any patient should be aware of urinary tract infections, and they're very easy to sort of diagnose also. If anybody asks me, how am I supposed to detect a kidney disease? In a very brief setting, we can say one has to check the patient's blood pressure, get the urine examination to look for proteinuria, any RBCs, WBCs, and also check the creatinine, serum creatinine in the blood, and calculate the GFR or the glomerular filtration rate, which is very easy to do by online formulas which is available. Now the next question which usually is asked is, who are the people who are susceptible or are prone to develop kidney diseases? Patients above 65 years of age, smokers, long-standing diabetes, hypertensives, patients who take painkillers regularly, patients who use indigenous medicines or other kidney specific medicines would be the ones who are more prone to develop kidney diseases. Any patient with recurrent history of stone, recurrent urinary tract infection, or any other congenital disease or a strong family history of kidney disease would also be considered to be susceptible or more prone to develop kidney diseases.